Everyone has a different pain tolerance and reacts to pain in a very personal way. Many factors go into how a woman feels during labor. These include your pain tolerance, the position and size of the baby, and the strength of contractions. Women should think about their desires and goals for pain control and discuss them with their OB provider during pregnancy in order to be prepared for labor and delivery. While formulating your plans, it's important to keep an open mind and remain flexible because the course of labor and delivery can be very unpredictable. It is a fact that when you experience pain, you tense up. And the more you tense up, the more fear you experience. And this makes you experience more pain, which makes you more tense and more afraid. And hormones are released that can actually make labor longer and more painful. Pain passes through nerve gates, which reach the brain, and only so many messages can register at one time. You can block the brain's sense of pain by matching the pain with something else, or by crowding the nerve gates. You can flood your brain with calming and comforting touch, sights, smells, and sounds. A positive attitude, realistic expectations, breathing, a calm environment, positioning, touch and massage, imagination and perception, and aromatherapy are all non-pharmacological interventions that can lessen your pain and ease your labor. These interventions also prove helpful for women who are planning on an epidural, since contractions and pain occur before an epidural is possible. My most important tip for pain management is to have a positive attitude. Labor and delivery is the one place in the hospital where if you're hurting and full term, you can be excited. No amount of crying or screaming is going to make contractions stop, so let them happen. Each time you have one, remind yourself that it's one contraction closer to meeting your baby. This shift in attitude takes fear out of the equation and actually makes you better equipped to handle pain as you realize that what you're feeling is normal. Have realistic expectations and be prepared for labor and delivery to hurt a lot. Studies have shown that women are often caught off guard by how much it hurts, and this leaves them feeling unprepared and helpless during the experience. OB providers and childbirth instructors can educate you on what to expect. If this is your first baby, take a prenatal class so that you're well informed by reliable sources and know what your pain control options are. One of the things I say most commonly on labor and delivery is take slow, deep breaths. This is actually very hard to do. Imagine dropping a hammer on your toe. What do? You tense up, say a few choice words, and hold your breath, sometimes even hyperventilate. Breathing, thankfully, is usually an automatic response. It happens whether we think about it or not. But when we experience pain, we have to take breathing out of automatic and put it into manual because our natural response to pain is not helpful. Holding your breath and hyperventilating affect the oxygen and carbon dioxide levels in your blood and will eventually start to affect how well your organs can function, including your uterus. The key is to take rhythmic, deep breaths and coordinate breathing with contractions, in through your nose and out through your mouth. Each breath should be equally slow and deep. Counting can also help. Your labor partner can count to help slow down or deepen your breathing if necessary. 3 or 4 counts in, 3 or 4 counts out. Along with breathing, vocalizing can be helpful and empowering. This is where you make sounds with your voice and breath that can include moans, groans, hums, sighs, or chants. This might sound unnatural now, but during labor it feels very natural. Low, deep sounds are best. They help you focus your energy and set a rhythm for breathing. High-pitched sounds can make you feel out of control and frightened, so avoid those. Whatever sound you make, a moan, groan, or hum, let it come from your chest, not your throat. Consciously relax your mouth, jaw, and your throat. Drop your shoulders, and let the deep sound flow out. Don't force it. Muscle relaxation is both a mental exercise and a physical experience. If you can consciously relax your voluntary muscle groups, you can help your labor progress with less tension, less fear, and less pain. With your body in a comfortable position, relax your body to a count of 3. Let go even more and relax more deeply with each number and count. Imagine each muscle from your head to your toes relaxing. If one area of your body is excessively tense, make that your focus. To practice for this, Use progressive muscle relaxation exercises at night before going to bed. This will help you learn to relax your body on command. Create a relaxing environment. Think of reasons why spas are so relaxing. The lights are low, relaxing music is playing, quiet voices are used, and people are calm. Create this environment for yourself. Keep the lights low, play music that is soothing to you and that elevates your mood. Choose a trained companion to be there with you during labor. This may be the father of the baby, a partner, or a trusted friend or family member. Only invite friends and family to the hospital that will be supportive and encouraging to you. Emotional support will help you cope with pain and has actually been shown to improve obstetrical outcomes. We've all experienced pain that was alleviated or made worse by certain positions. The same applies to labor. You may find that certain positions make pain worse and others help you cope better. There are many different positions that are possible in the hospital during labor. Walking can be very useful during the first stage of labor. If your labor is slow to start or progress, walking can help establish a good pattern of contractions. During contractions, stop and lean on a support, swaying your hips. Upright positions like walking and dancing use gravity to increase the work of contractions. This position, the labor dance, can be very relaxing and lets your labor support partner reach your back for soothing pressure or massage. To do this, stand up, facing your labor support partner. Put your arms around your partner's shoulders and neck. Then rest your head on your partner's chest or shoulder. Your partner's arms go around your sides, hands clasped at your back. Sway together like you're slow dancing. For deeper relaxation, have your partner massage your back or speak soft, encouraging words into your ear. The lift is another upright technique that can help move a baby into a preferred position for labor and delivery. To do this, stand with your back to your labor partner. Their arms should be around your belly, with hands meeting under your belly. As contractions start, your partner should lift your belly up. You can also use your own hands to help lift baby and belly during a contraction. In between contractions, continue to walk around. Leaning positions help to relieve pressure on the pelvic floor and create more space and freedom for your baby to change positions in your pelvis. It may also give you a chance to rest during labor. Sit on the edge of the bed and lean forward over the bedside tray, or kneel and lean over the raised head of the bed. You can also lean over a birthing ball. Sitting positions allow you to rest and conserve energy while laboring. To do this, raise the head of the bed and recline with your arms and back supported by pillows. You can also raise the foot of the bed so you can support your lower body with your feet. You can sit on a birthing ball as well. They are used frequently by women in labor because they offer gentle pressure to the perineum, which may actually block your body's ability to send pain messages to the brain. Rocking chairs can be relaxing and soothing during labor. The chair supports your weight and keeps your pelvis moving. Develop a rhythm that helps you relax. This may vary depending on what is comfortable to you. During contractions, try to rock forward, breathe, and then hold that position. Reclining or leaning back in bed can be very comfortable during labor. Your head and back can be supported with pillows. This can also allow your support person to rub your hands, arms, or feet if desired. Side-lying positions can help if you're having trouble relaxing. It takes pressure off your muscles and lets your uterus come forward easily during contractions. Your nurse may instruct you to lay in this position for your baby's well-being, since blood flow to the baby is enhanced when the mother is on her side. Your back and belly can be supported with rolled-up blankets or pillows, and this offers slight counterpressure that can be very comforting. A peanut ball may also be used in this position, which props the pelvis open, helps the baby to descend in the birth canal in the right position, and ultimately can help labor go faster. Squatting can be done during the second stage of labor or when it's time to push. This helps to change the shape of the pelvic opening and uses gravity to help the baby move through the birth canal. To do this, hold onto a bar or other support during a contraction. Hands and knees can be helpful if you have back pain or want your support person to rub your lower back. It also relieves downward pressure and can be done on a bed or a birthing ball. A warm bath is comforting and can actually increase your pain threshold or ability to cope with pain. Laboring in the tub may be possible depending on your circumstances. Talk with your OB provider if you're interested. There are ways to monitor your baby while allowing you to enjoy the comfort a warm bath can provide. Be sure to avoid overheating in the tub, which puts you and your baby at risk. The best benefits of water immersion are achieved when the water is at or slightly above body temperature and you're not in the tub for prolonged periods of time. You can also try a shower and let water spray directly on the area that feels especially sore, like your lower back, for example. It is helpful to use this as guided imagery. Imagine the water rinsing away the stress and tension. Many women find that their ability to cope is enhanced by switching up positions. For example, you might try sitting on a birthing ball, kneeling on your hands and knees, getting into the tub for 15 minutes, and then getting out and trying the slow dance position with your partner. Touch and massage is helpful because it communicates reassurance and counteracts something painful with something relaxing. It is often most helpful in doses or as desired by the laboring woman. It is also best to start with a gentle, smooth touch or long strokes, and then try heavier kneading touch if she asks for it. The neck, shoulders, back, feet, and legs are often relaxing areas to rub. Tennis balls are used frequently by women to either apply pressure to small areas or for the woman to squeeze during contractions to help her focus her attention and energy during contractions. Simply placing a warm, firm hand on the woman's back, abdomen, upper chest, or head can bring comfort and be encouraging. Counter pressure helps to offset intensity from contractions and eases ligament, muscle, and joint pain. During a contraction, apply steady, gradual pressure to the sacrum, or the bony area below the small of the back and above the buttocks. Try a slow circular motion from time to time. With your hands on either side of the woman's hips, press inward towards the pelvis during a contraction. Wait until the contraction eases, then slowly release. This is most easily done when the woman is on her hands and knees. With the woman sitting in bed with her legs bent up at the knee, push on her knees and aim to push her thighs back into her hips during contractions. This is especially helpful for women who are having a lot of back pain during labor. Distracting your mind will help to keep you in a positive and calm state that helps you to manage pain. Mental distraction can come in many forms. Affirmation involves focusing on words that affirm your experience and strength. Examples might include telling yourself, "I am safe," and "my baby is safe." Or, "As I relax, my baby comes closer." Another example of imagination and perception is listening to stories. Have your labor support partner tell you a story or memory from your life, being sure to describe all the senses: sound, sight, touch, taste, and smell. The rainbow technique helps you to visualize and vividly experience all the colors of the rainbow.
Should we do some color associations?
Yeah.
It engages your mind and senses,
About the color blue.
blocking pain messages to the brain.
Think about
Have your support person say each color of the rainbow and expound on each.
a nice breeze coming off that blue ocean. You can smell the salt water. Okay. Let's think about all that. Let's think about the color red. Let's think about the smell of strawberries.
You may also try guided imagery. Predetermine some of your favorite places you've ever been to, or a place that you want to go to. For example, if you choose Hawaii, spend time now creating this space in your brain. Think of the warm sand, the grit of the sand beneath your back and your toes, the warm sun beating down on your shoulders, reminding you to put sunscreen on, the sound of the seagulls, the rhythmic beat of the waves, a slight cool breeze cooling down your body, the salty taste of the ocean on your tongue and in your nose. You can literally take your mind to another place and remove yourself mentally from the pain of contractions. Certain scents such as lavender, rose, and frankincense have been used during labor to reduce anxiety, fear, pain, and even nausea. Studies have shown that about half of women who use these essential oils found them to be helpful. Now that we've gone through the main points of breathing and relaxation, it's important to understand that these tools don't take pain away. Knowing your options for pain control, both non-pharmacological and pharmacological, will help you have the best experience possible during labor and delivery. If you have more questions about it, talk with your OB provider. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms or on our Instagram at Intermountain Moms, and recommend us to your friends and family too.